Good evening. My name is Georgia Wright, and I'm a registered nurse from here in Evansville, Indiana. And this is my presentation on tobacco dependency and related diseases for Epidemiology 501 for spring of 2021. Today we're going to be talking about tobacco dependency and associated diseases and how it's a global health epidemic and just some certain diseases that are caused by tobacco dependency and national and local efforts to help reduce smoking rates in the area. So let's jump into it. So regarding the tobacco epidemic, key points that I will be discussing are specifically on nicotine dependency, as well as what I call the three big C's: coronary heart disease, COPD, and cancer. And then I'll also be talking about those collaborative solutions with the World Health Organization, Indiana Legislature, and the Vanderburgh County Health Department on just ways that they are all working together to reduce smoking rates in Indiana and globally. Public health awareness regarding nicotine dependence, is such a huge deal that a lot of people don't think about. Nicotine is the main chemical in tobacco that causes addiction. Tobacco, along with alcohol and caffeine, have all been researched by renowned scientists around the world through the World Health Organization and found that these drugs are actually classified into psychoactive drugs. Of course, they are all legalized. Even though nicotine has been recorded to, along with the caffeine and alcohol, to have an immediate effect on the brain, they have been known to change a person's disposition and thinking process, but definitely is one of the most socially acceptable drugs in the world. One of the first diseases that I wanted to discuss is coronary heart disease. For those of you who don't know what coronary heart disease is, it is a buildup of fat in the arteries that causes narrowing. That narrowing actually impedes oxygenated blood from adequately returning to the heart. That lack of blood can cause the heart to be injured and possibly die, and it also can lead to other diseases, if not death. The World Health Organization has done several studies on tobacco and coronary heart disease. They found that coronary heart disease is the leading cause of death and disability globally. The disease contributes to 9.4 million, or 16.6% of the 56 million global annual deaths. That smoking is responsible for 1.62 million, or 18% of global deaths from coronary heart disease. That's insane. 1.62 million global deaths from coronary heart disease associated with smoking. An estimated 382,000 people died of coronary heart disease attributable to secondhand smoke exposure. And that study was done in 2017. It represented about 4.3% of all deaths from coronary heart disease and 31% of all deaths from exposure to secondhand smoke, which I found pretty alarming. There was also some older studies that I found, which I felt like those were pretty interesting because they were kind of on the horizon of studying secondhand smoke exposure. They were done in the 70s and the 80s. They were done over multiple countries, really just demonstrating the adverse effects on kids in secondhand smoke exposure. And it just showed the development of cardiovascular disease, including early onset atherosclerosis, which was just insane to me that was something they were able to discover that was developing in childhood. The third disease that I really wanted to talk about is COPD, or if you're not familiar with that acronym, it's chronic obstructive pulmonary disease. Multiple research studies have indicated that COPD is one of the top 3 leading causes of death in the United States and other large countries such as China. COPD is known to be caused by long-term exposure to air pollutants and irritants. The primary cause of COPD is smoking. What was even more striking was I found that 80 to 85% of people with COPD acquire the disease from smoking. That's a very large number, and the disease is pretty torturous, especially in end stage. Basically, you're suffocating. So I felt like, for this to be such a preventable disease, nicotine dependency definitely has contribution to this disease specifically. Lastly, with COPD, what I wanted to touch on was just the percentage prevalence among gender. And you can see that obviously men here, 20% versus 12% with women. And then you look at non-smokers. One of the things, and this study came out of China, looking at COPD, I found that women smokers are 13 times more likely to die from COPD than non-smokers. Comparably, men who were 12 times more likely to die from COPD than non-smokers. So, interesting fact that women are more likely to die from COPD than men. The final disease that I wanted to talk about is cancer, specifically lung cancer. The American Lung Society had some percentages that came out recently that stated that around 80% of lung cancer in men is caused by smoking and 50% of lung cancer in women is caused by smoking. And these numbers are from the United States. But another study that I found from China revealed that lung cancer is the primary cause of lung cancer deaths worldwide and is the most prevalent of cancers. So something that's completely preventable, that's tied to smoking, is something that, is being caused by this drug. Definitely, this study from China also showed a high correlation of lung cancer rates in passive smokers who live in the same household as the primary smoker, which I found interesting. They weren't able to actually do the study on men that were non-smokers with women who are smokers because that was really not a number that they found applicable to their population. So typically the man was the smoker and the female was the non-smoker in this study. So typically females were pretty highly likely to get lung cancer even as a non-smoker. It accounted for 11.1% of lung cancer deaths. So again, very interesting. So the first thing that I want to talk to in regards to reducing the rates of smoking will start globally with the World Health Organization, just mainly because they are kind of the front runners and leading researchers on, just global research regarding smoking. So in 2005, they released the Framework Convention on Tobacco Control, really just highlighting initiatives for local organizations to collaborate with global forces to share information so that we could, further reduce rates of smoking, whether that be with effective treatment plans or, just statistics that have worked in other countries, whether they've taken, local initiatives with taxes or whatnot. And really just pushing for each country to adapt this control framework and modify their current cessation infrastructures And then just lastly, for local providers to just take that initiative to educate their patients on smoking cessation so the patients don't fall through the cracks. So that actually led to the Indiana State Department of Health in 2015, really just adapting that framework that was released by the World Health Organization, and just truly echoed that mission to reduce smoking rates. Indiana really focused on education, decreasing smoking rates specifically in youth and adults, and then increasing the number of those not exposed to secondhand smoke. So one of the things that they did to start that out is in 2007, Indiana did one of many state tax increases on cigarettes, raising it, almost doubling it, actually from 44 cents a pack to 99.5 cents per pack. Since they did that increase, tobacco consumption has dropped 22%. They've also put some measures in place to protect people from secondhand smoke. Just putting in municipal counties have put in place 100% smoke-free workplace laws. Schools, restaurants, healthcare facilities, and universities have also followed suit. Really just pushing forth for local counties to start offering services to Hoosiers to assist them in maintaining cessation. Then here locally in Vanderburgh County, Southern Indiana, our Department of Health really has stepped up, and they have created a 5-step cessation program. That program is normally in person, typically spans over about 5 weeks. It's in 1 week, one class per week, typically an hour at a time. And those classes really just address stressors or triggers for smoking and healthy coping mechanisms, so that patients can, deal with their addiction to nicotine and, find those healthy coping mechanisms to effectively quit smoking and maintain that smoking sensation. The county provides the materials free to participants that sign up in this program. That can range from any kind of type of educational material to the patches or medications that they may need. They can help them get those medications at low cost or free, so that they can achieve cessation. And really one of the things I thought was interesting was they talked a lot about stressors. So really just helping those patients just deal appropriately with emotional triggers, so that they could effectively find other mechanisms that were not as harmful. So the big question is, have these efforts been effective? Just in Indiana, the smoking rates from 2005 to 2019, which is the latest data available, the smoking rate was 27.3%, down to 19.2%. So quite a big drop there. You look at national data, the smoking is 20.6%, down to 15.2%. So, they're staying pretty in line with it. It's still a big push when you think about that 15% of the population in 2019, still smokes, and that's, nationally, and then 20% for Indiana. So we still have a little bit of work to do. And it's going to be an ongoing effort from all sources. So thanks for hanging in there with me, and I hope you have a great day.